Pelvic Inflammatory Disease, PID. Symptoms, causes, and treatment. Pelvic inflammatory disease is a serious health condition affecting people with female reproductive organs. Often caused by untreated infections, it impacts the uterus, ovaries, and fallopian tubes. Without proper care, PID can lead to long-term complications, including infertility or chronic pelvic pain. If you've ever dismissed pelvic pain or unusual vaginal symptoms as normal, think again. PID is a silent attacker that can cause irreversible damage if left untreated. Let's discuss why it's important to understand this condition and act promptly. Recognizing the signs of PID early can save lives. Common symptoms include pelvic pain, lower abdominal discomfort, unusual vaginal discharge, or a foul odor. Some individuals may experience fever, painful urination, or irregular menstrual bleeding. However, many cases of PID show mild or no symptoms at all. This silent nature is what makes regular health checkups so essential. If you've noticed even subtle changes in how your body feels, it's always better to consult a healthcare provider. PID often starts with sexually transmitted infections, STIs, like chlamydia or gonorrhea, but it isn't limited to these. Bacteria can travel through the reproductive system after childbirth and abortion, or even during IUD placement. Ignoring early treatment for STIs increases the chances of developing PID. Protecting your sexual health by practicing safe sex and getting regular screenings can go a long way in preventing this condition. Awareness is your first line of defense. Diagnosing PID can involve a combination of methods. Doctors may ask about symptoms, do a pelvic examination, and conduct tests for infections. In some cases, ultrasound or other imaging techniques may be needed to assess internal damage. Remember, though a diagnosis may seem intimidating, taking this step is crucial to begin proper treatment. Early diagnosis helps avoid the long-term complications associated with untreated PID, like scarring in the fallopian tubes or infertility. The good news is that when detected early, PID is treatable. Typically, doctors prescribe antibiotics to target the underlying bacterial infections. It's critical to finish the full course, even if symptoms improve, to ensure complete recovery. In severe cases, hospitalization may be necessary, especially if there's extensive damage or an abscess present. Surgery is rarely needed, but ignoring the condition can make this last resort option unavoidable. Timely action is key. Prevention is the most effective approach to combating PID. Use protection during sexual activity and get tested regularly for STIs. If you're considering an IUD or have recently had surgery, discuss the associated risks with your doctor. Being proactive about your sexual and reproductive health not only helps you prevent PID, but ensures a healthier life overall. Awareness and regular medical consultations are your most reliable allies in staying safe. Pelvic inflammatory disease is a manageable condition when caught early, but its silent nature makes awareness critical. Know the symptoms, understand the risks, and seek prompt care if needed. If you haven't already, prioritize regular gynecological visits to keep yourself informed and secure peace of mind. Don't wait for symptoms to escalate. Take charge of your reproductive health today by scheduling a consultation with your healthcare provider. Share this information with loved ones because education is the first step towards prevention. Your health is worth the effort.